we say, well, we've lost you in the system. You moved to another province, maybe, but you are back in Gauteng now. So what makes us good is that we are able now to check in our systems that you have not been coming to the clinic to collect your medication. I personally go there with my community health workers in your house, because we want to know what made you to now to not to take your medication for TB. Then you'll explain to me those problems, but we'll intervene where we can. Sometimes they will tell me that I'm tired of drinking pills. I don't have food. I don't have this. And then we'll create means
But that's very
that the
important.
Department of Social Development must organize food parcels for them. But even on our side, we do assist when it comes to those things, because that's an easy way to do. But again, on that strengthening of our primary health care, I want to tell you something that now we've done. We have a slogan now in the department that says, one clinic, one vegetable garden.
Okay.
One hospital, one vegetable garden.
Really?
Because when you bring a child is malnutritioned, or myself I'm malnutritioned, it's easier for you now to say, can you give a spinach, mama? Just have spinach when you eat, even if you eat it with pap, so that you can get that strength.
And
so
that's
it's
very
really
important, because
helpful.
our communities are struggling.
Absolutely.
So MEC, some people don't know why we are talking. They've just switched on their radios. They are in Sidibeng, they are in Mogale City, they are in city of Johannesburg, and they are in Ekurhuleni, they are in the city of Tshwane. And just to bring them on board, if you've just joined us, welcome. My name is Thabo Shole Mashao. I'm invited by the Gauteng Health Department to have a conversation with the MEC about what is happening as far as health is concerned in our province. The clinics, the hospitals, and everywhere else. How do we get things right? Many of you, many of us go to the clinics every day. Either you don't feel so well and you get to the clinic, you are sitting there. How's the queue? Are you getting a smile as they are helping you? The MEC has been saying that they must serve you with a smile. And this is after an occasion, a big event today, where there was an induction and a process of introduction to the ComServe, to the doctors. MEC Nomantu Nkomo-Ralehoko is the MEC of Health in Gauteng, and she's my guest. We are talking about generally the state of health and the department. What's the department doing? Because they are serving us. It's not the other way around. MEC, there was a time when the department was just a beacon of excellence. Then it changed. Things started going south a little bit. Things were not okay. There were many complaints. But it looks like you really managed to turn the tide. What was going on, and what did you have to change to get us on this road?
I think, Abo, you are right, because when I arrived again in October, we were getting more complaints than compliments. And I sat down with the team. I told them that because we are having these complaints, let's have a way of addressing them. Immediately when I send a complaint, it must be sorted out. I'm here in this hospital, there's a long queue. You must tell me what needs to be done. So we had to set up controls in the department, including the financial side, by the way.
Yes.
When Premier took me to that department, he said I must go and make sure that that department have money. I must change the financials. I arrived there, strengthened controls. And I'm proud to say to you, we are 5 to knocking on the door of a clean audit.
We can't wait.
Because even last year, AG said to me, the only area where we were weak, which I accepted, it was on assets management.
I see.
Remember, we have about 47 hospitals, including those specialized hospitals that we have, and we have clinics. All these, when you do assets management, you account for each and everything that you get. And if you don't know, and you don't have a plan, definitely AG will have a problem with you. So it was one of the things that AG lifted, the assets management, controls in the department. I set up those controls. But besides that, I was there now. There was a war room when I was in finance that I was leading, making sure that the Department of Health is part of those departments that I must assist them through the war room with my team from finance in my previous life. So, but when I was there now, then I knew already that here in my house now, we have problem of controls in terms of finances. Then we set up those controls, and I think towards the end of March 2023, we're better off as a department, because everyone now knew that if you want to do this, this is the process that you must follow. These are the things that I must done. And we even change our attitude of not punishing people when they've done wrong, because we'll get some reports sometimes from the chapter 9 institutions that we must act on. So it was difficult for colleagues to act on those. So I set up a template that when there is a case, it's a warning, but let's evaluate all those things. And hence I even strengthened some of the people that are assisting me on the appeals, because when you are fired, maybe in Dr. George Mukari, you can go and appeal to the MEC. But I will look into that. So I have a pool of lawyers.
I see.
I think it's only one doctor. There are about 5 that are
Yes.
advising me specifically on the appeals.
Yeah.
So we dealt with those appeals. So I will always check them. If they said you've stolen sugar, definitely there's somebody that is an accomplice on that. So we'll have to deal with that
Yes.
part. And you
Yes.
can laugh like you are laughing, Tabo.
Yeah.
Ezinye mani into zabe, yabo, hayi, lona ke noko. Lo muntu lona, one of the cases, this guy, he went to Cape Town
Yeah.
and with friends, but here he didn't even report or take a 1 day leave for 2 days.
Nothing.
Leave. Nothing. And then they saw him in Cape Town, because they took a photo of
Yeah.
social media everywhere.
He's
Bonobini.
posting.
And their nurses, this guy is a group of nurses, I think they were about 8 or 10. So, but when he was called now, then, what's your story? What
Yeah.
happened? No, I was sick. Then they show him the photos on Facebook. So, and now I must deal with the appeal.
Yeah,
So those are the interesting, because I was laughing when I was dealing with this thing. At
Yes.
least let's not fire him, but he
Yes.
must be punished.
Yes,
3
to understand.
3 months with no salary.
I see.
So want to test your strength now.
Yeah.
Can you stay
If you are really
without a salary
committed.
for 3 months?
Yeah.
So those are the things that we dealt
Sure.
with. But it's very good because strengthening those controls, because again, even at HR, we
Yeah.
didn't have a very strong HR. So we're trying, and all the units, they were operating in silos, because they like the thing. So now we had to try and centralize some of the work that must be done through central office. But at the same time, I didn't want us to be too bureaucratic,
Yes.
because sometimes that makes you not to perform,
I see.
especially in our area.
Exactly.
So we had to balance that, but at
Yeah.
the same time, I'm sure you've heard me, that
Yeah.
this is now we're an employer of choice.
I
Because
see.
the group that you see here,
Yeah.
most of them were not deployed in Gauteng.
I see.
But some of them wanted to come to Gauteng.
Yeah.
So because they can see the level of work that we're doing.
Yeah.
But again, if on that area of more compliments now than complaints, we had to sit down and have a strategy on how we deal with complaints, besides introducing these campaigns.
Yes,
Then
yes.
I serve with a smile, Wellness Wednesdays that we have done. We do some walks, hiking
Yeah.
with the team, but we extend it even to the community
I
members
see.
out there.
I want us to take a quick break, and we are going to come back and then continue our conversation. Sikhuluma no MEC of Health in Gauteng Province, Nomantu Nkomo-Ralehoko. My name is Thabo Sholemashao. We are back with you. Please, if you are listening from a clinic, if you are listening from home, if you are in Tembisa, if you are in Dobsonville, if you are in Zola Clinic, if you are in Rankua, wherever you are, please give us a call. 011-982-4495, and then we'll take your call. You can speak to the MEC and ask her the questions relating to you and your health situation wherever you are. We are back just now.
Separate.
At a mall, hospital, months, or medical condition that does not require regular clinical review by the doctor. Ask the hospital or clinic where you are currently getting your medication to register you on Double Up Meds and take a shortcut to collect your prescription medication. This message is brought to you by the Gauteng Department of Health. Hashtag Asibe Healthy GP.
We are back with you again, and you are wondering what is happening on my radio. You're not getting regular programs today. We thought, listen, just for today, let's look at the hospitals, let's look at the clinics, let's look at the health issues, more Gauteng, where we all stay, and speak directly to the big boss and say, why are things going like this? What's going on? What can we fix? Or maybe you've got a compliment. They helped you, you had a baby, and they treated you very well. Well, tell the big boss she's here, MEC of Health in Gauteng. My name is Thabo Sholemashao, and we are coming to you live from the city of Ekurhuleni. I'm with the MEC of Health, Nomantu Nkomo-Ralehoko, and we are happy to take your calls. It appears that we have a caller. Let's try again. We have a caller. Hello, good afternoon. Ke teng le kae? Re bua le mang pele?
Pramfisha Soweto.
Ke kopa o bue gape re bua le mang?
Di Dineo ko Pramfisha ko Soweto.
Dineo ko Pramfisha ne? Hey Dineo, MEC go mametse, no batla reng?
Nne ko go botsa ntate MEC gore mo Pramfisha ba tlo go agela because re sebedisa di-container and which is no highly winter le a pula ena batswadi ba rona ba sokola.
Dineo or le sebedisa di container ko Pramfisha and
Ko
batho ba
Pramfisha.
bagolo ba sokola.
Re kopa ba re agele tleliniki.
Oh, o kopa le
Yeah,
agelo
like
clinic
say,
ka mo.
Because of our situation mo le ko holong ha o be nothing ba tla protest ba phala mo le ko tleliniki.
Okay. I think re go tlile Dineo. Thank you so much. O mamela ge ko re diong gore MEC o tlo reng ne? Sharp Dineo, MEC?
I note what Dineo is saying because I know part of our list on infrastructure, Pramfisha is part of those. And I'm sure in this financial year there'll be something that is being done. But what I usually do then when I get a person like Dineo, I always want to visit the area and see if those containers are decent containers for us. So I think I will do a follow-up and go to Pramfisha. And my team, I know is listening, they will take me to Pramfisha.
Sure.
I know Pramfisha Clinic, but
Yes.
I would want to have a discussion so that even the councillor in the area is aware that there is this big change that is going to come. Instead
Yes.
of containers, there will be a change. Remember, Pramfisha, it's big now.
Very big.
It's very big now.
huge.
I foresee maybe there is overcrowding already in that
Yeah,
clinic.
yeah,
If
yeah.
that's the one that I know.
Yes.
But we'll definitely make a follow-up to her so
Yeah.
that she is aware.
Yeah.
I'm sure the chief director will take even the contacts like
Yeah.
so that when I go there,
Yeah.
I invite her to be part of
Come
my
and
trip.
see.
Yeah.
Ne? Yeah, Pramfisha ko Dobsonville.
Yes,
ka mo.
Dobsonville,
Yeah,
yes.
yeah.
But because if you can see, it has moved. You remember, people that are
Kagiso.
coming from Just Cake when we were doing cleaning up
I
Just
remember.
Cake, those people that were staying
I
next to the
remember.
river, they were taken to Pramfisha.
Yes,
Some of them,
yes.
some of them went to Deep Slot,
Deep Slot,
where I was this
yeah.
morning. So you can see now that the population is growing in that area
Yeah,
too.
yeah.
If we had money, we will be like Cubans and have a clinic in every ward.
Yeah.
That has been my dream. Hence,
Yeah.
the issue of mobile clinics. I wanted it to be done when I arrive in the department because it helps you to reach out to those areas where
Certainly.
people can't go there. Because our aim again is to prevent diseases so
Yeah.
that people don't even go to the clinic. Hence the Wellness Wednesdays that we introduced so that you can walk around your yard.
Yes,
When you go to the
yes.
clinic, you just go there and take your medication.
Yeah.
But again, we no longer, we're encouraging people to go and fill in a form
Yeah.
so that you can be given your medication after 3 months or after
Yes.
6 months and then you come for a checkup. So we call that CCMDD. You will go to every clinic,
Yes.
you just get your SMS, you go there in that post box, you open with your cell number, with that PIN code that is
That
in,
you're
cell,
given,
in your
yeah.
cell phone, and then you get your medication. Say, Peggy,
Really?
nobody sees you when you get there.
Really?
Ukuthi wena uzolanda amayeza anjani na. So I like it because, and I encourage people that we must have that in the clinics.
Yes.
But there are those clinics that we don't have those lockers.
Yes.
We pack them and then we put them nicely
Yeah.
according to your names. Then you come
Yeah.
and get your medication.
Yeah. And Miss-
Especially for chronic.
Yes.
And again,
yes.
in Soweto, what we are doing, there are community health workers that go and deliver in Gogo's places. If you go to Deep Kloof, Gogo's will tell you, hey, andikho ndiyemngcwabeni, uzoletha kusasa amayeza ami." That's how they are. But
Yeah.
I'm happy that they are spoiled
Yeah.
and we are spoiling them because they no longer go to there to get
Yes,
medication for
yes.
food. But again, we are trying to dissect the systems. If it's elders, this counter 1, 2 must be for the elders, 3, 4, 5, it can be for the young ones, so that they can get attention immediately and they move. And I always say to CEOs, after 2 o'clock, I don't want to see people standing in the queues.
Yes.
At that time, everybody must go home.
Yeah.
So when I arrive in every hospital, if I come in the afternoon, you are going to tell me, why did you sit in the office and not go and help those people
Yes,
that are in a queue
yes.
there? Because sometimes you realize that if you are there, the queue moves
Yes.
very fast when I'm
Yeah,
there because
yeah.
I get inside there and I roll my sleeves.
Yeah.
I say, let's push the trays.
Yeah.
Medications opalayo, mina ndiye-accountant and ndiyonikeza umuntu according to what is written in the script. It's easy. But
Yes.
sometimes we tend to make those things difficult.
Yeah.
And that's why we are changing Gauteng now to be the better Gauteng than it used to be. We want to take it back where it used to be
Yeah.
because we've declined, But now the graph must go up.
Yes,
And I
again.
think it's going up because I want to say to you, go to some of my hospitals, Mamelodi Hospital, one of those.
Yeah.
In fact, we're benchmarking all the hospitals with Mamelodi Hospital.
Really?
Because it's one of the best well-run hospitals by Dr. So, there was our
Yeah.
CEO. You go to Pulusong, you go there, you'll find that hospital. It's one of the best. They call it Abandase Springs, Nango Prakpan. It's their private hospital, they say so.
Yeah.
You go to Pulusong, right
Yeah.
in the heart of Tsakane,
Yeah.
Pulusong Hospital. They used to call it Nyulusong, now it's Pulusong. And it's one of the best.
I won't ask why they called it that.
Yeah,
I
they
want-
say people, when you go there, you will die. That's what they
Yeah.
were saying when I asked them.
Yeah.
But now it's one of the best well-run
see.
hospitals because we are renovating even our infrastructure in the hospitals.
Yeah.
So there's that huge change that we want to do and
Yeah.
that we are doing in the hospitals.
So
now.
you've spoken about Mamelodi, you've spoken about Pulusong. Bengifuna ukubuza MEC ukuba which other geographical areas are problematic? So I understand Mamelodi is doing well, I understand Pulusong is doing well, but you must have some areas that are
yes, I
not
do.
up to scratch.
I
What are some of those?
One of those, it's Jubilee. I was there for 3 weeks working there during cholera, and we tried to do something, but it's an old hospital. It services people that come from Limpopo, from Northwest, from Mpumalanga. And it's next to the road, you can see.
Yes.
But it's not an excuse for us not to renovate that hospital and make it bigger. But now, as we speak, the contractor is on site, making sure that we renovate some of the wards. But we have APTs there, we've opened those APTs. It's like a private hospital in those APTs, beautiful. You have your own space on your own. But that's where I know that even in terms of management, I fight with my managers, including my CEO, that is running that hospital, because I want it to be better. Then the second one is Kalafong.
Yes.
Even Kalafong is an old hospital too, but we're trying to renovate now.
Where's Kalafong?
Kalafong is in Attersville.
Okay.
So we're trying now to renovate again the accident and emergency area in Kalafong, including other areas where we can see that things are falling apart.
Yes.
So there is an improvement that we're trying to do in those two, because Kopanong used to be one of those, but now we're rescuing Kopanong. You can go now, you'll see it's getting better.
Yeah.
Because there are 2 wards for mental health that we're not even utilizing them. They were closed literally for years. Now we've opened up those wards. We have renovated them. I'm going to in fact, I'm going to do an official opening with those wards, including the OHS area. Because I said in all the hospitals, let's have our OHS, occupational health certificate in there, that we've passed in the hospitals.
Yes.
Because we're not passing even that. You'll find a hospital that is a hospital, it's around 40 or 30%. You can't, they must comply.
Yes,
So there's
yes.
compliance in terms of what is expected, the ramps, the stairs, everything that was not right.
Yeah.
But again, the improvement, because those are old hospitals that I'm counting to you,
Yeah.
that in the back days, you will want to go there
Yeah.
and sleep in the hospital when you see
Yeah.
the patients wearing their blue gowns.
Yes,
So I
walking
said to
nice.
them, bring back that thing.
Again.
And there were centers of excellence, as you
Yeah.
were saying it earlier on. Because South Rand here and I were renovating it just here in the south.
Yes.
South of Johannesburg. It's now getting better, beautiful. It's run by a very young CEO.
Yeah.
That is there. He's a CEO that is acting. He comes from the township in Tembisa, but he's working that side. So
Yeah.
in fact, interestingly, all these hospitals that I'm counting, they're run by young people.
Really?
Yeah.
Yeah,
So
yeah.
I'm happy because I'm sure you have seen even the recent appointment of the 3 young CEOs
Yes.
that we have employed. And those hospitals, the 3 of them now are best well run. They've changed.
Yeah, yeah. It looks like we have a call. Let's see if we've got a call. If you'd like to call us and speak to the MEC, Uwele MEC directly, the big boss of health in Gauteng, 011-982-4495. Do we have someone? Hello?
Hello.
Good afternoon. Dumelang.
Le guy MEC.
Hello.
Hello, le guy.
Okay.
Re teng le kae?
Teng MEC. Ke na le complain. O itse ke ka ne ka ya Eden Valley Hospital.
Emma
Last
Bailey,
year ke
Emma
tlo
Bailey,
thola-
before ya go complaining, utlwela ausi. Kwena mang o phone le ko kae so that MEC a kgone go go thusa gantle wa bona.
Ke nna Kamogelo ko Dobsonville.
Kwena mang?
Kamogelo ko Dobsonville.
Kamogelo ko Dobsonville. Okay, Kamogelo. Ke eng problem?
Ka ne ka ba involved ko accidenteng last year December. E be ke isiwa ko Eden Valley Hospital. And then the way lento la ka le ne le injured ka teng ne ba sa tshwanna go le itshebe ba le sitha e be le bola.
Oh, no lonsa lino. Ebe ba
No, because I was involved in an accident. ebe ke ba injured ko lentong.
O mo ba le eng?
Ebe ke ba le injury ko lentong.
Sure.
So ebe bang speech ko Edenvale Hospital ba sa tshwanna gong speech. So lento la ka ebe le ba septic
Yeah.
because of bang speech le ba sa tshwanna gong speech.
Yeah.
And then checkpoint ebe ba contact but bang contact and ever since azange ba sa go tlhela kone.
No ile ko kae ko sepetlele se sefeng?
Edenvale.
Ko Edenvale. Okay. And then le gona no a o se thole thuso.
Thuso ke bile ka e thola but go private hospital. Because of
Oh.
me never ke dile ka lentswe le le bodileng.
O ba go thusitse ko private hospital ka loto.
Yes.
Okay, gona no o sharp.
No, akusike heal.
Ha o swetseng?
Akusike heal. I'm still akusike heal properly. I'm still like in the healing process, but and like pelo ka ne le botlhoko because of
Yeah.
ile go sepetlele ke nagana gore ke thola help and then ke end up ke bola lento. I understand.
Yeah.
Mm.
O so batla no batla MEC a shebe taba eo.
Ke a kopa.
Okay. MEC, I don't know if you got the gist of that. So she was involved in an accident, a car accident, and she hurt her leg. As a result, she went to a public hospital. They stitched her leg, and it became septic, and she had to go to a private hospital to get all that sorted out now. So she wanted to bring that to your attention.
I'm sorry, Kami, that you went through that. And I think what you will do then is if there is some help that we need to do, Kami must leave the numbers so
Yeah.
that the team can communicate with her. And then we'll refer her to one of our hospitals. I'm sure Charlotte McClegg or Helen Joseph or any, I'll choose which one that to go with,
Sure.
yeah.
Kamo?
So they can be assisted, yeah.
Ka mo tlogela di number tsa gago ne, and then ba tlo go founela, and team ya MEC ba tla ba in touch le wena. Oh, Kamo is gone. But Kamo, I'm sorry about your experience. The team will be in touch with you. Thanks very much for that. Luena ba tlo phone gape, you are at liberty to do that. 011-982-4495. Do we have another call? Hello,
Hello.
good afternoon. Sanbonani.
Kunjani Thabo?
Siyaphila kunjani?
Ukhuluma nobaba uThiste Mzimhlophe.
Emzimhlophe.
Yeah.
Okay baba, qhubeka.
Ngicela iMC ibhara man. Hey, ekhemesi ebhara. And ngizwe iMC ithi yona emabhara mayithola emabhara ngabo 2 o'clock. Ngabo 2 o'clock uye ebhara ufike ekseni uthola ukuthi unamba 4,000 and something. And before ebhara abantu bechronic bebane window labo. Ngoba abodokotela bafika ngabo 11 12 emini masiphuma nje sewindow lesi special. Khona manje maphuma kubo doctor ngabo 12 uya le uyothola unumber 4,000 and something. Manje MC yangimangaza mayithi iza ema-clinic fanele ngabo mathuthu ngamamuthi. Sicela balungise indaba yasebhara ngisala lemsakazweni. Thank you everyone.
Yasebhara ne? Okay, ngiyabonga mfethu ne?
Ibhara Brwana.
Okay, ngibonge kakhulu siyabonga mfethu.
Sure.
I'm sure you picked up that one, MEC. The problem at Bara, even after 2 o'clock, the queues are very, very long. And we've brought it to the attention of the MEC. Yeah, MEC,
He's
I'm sure it's a-
correct,
yeah.
he's correct, because if you go to the clinic, there is a problem there.
Yeah.
In fact, now there is a system that it has started, it's in Kalafong, that system that we are doing by Dr. Mkokri, he's a pharmacist, doctor, by Mkokri there. And last week I was speaking to the CEO. I want CEO to understudy that process so that we can learn how can we do it at Bar. In fact, when I saw that Kalafong is doing it, was in Kalafong you will never find any queue even if it's 10 o'clock or it's in the afternoon. So I asked how is he doing it, so he showed me because there's an app that they're even using. So I told CEO, because she's new, Dr. Makana, that she must go to that site, and she has I think it's last week already that the team was there, just to learn how best can they do it at the pharmacy. I agree with Budi, that's where everything is packed. Accident and emergency area, they're able to push and people will go inside. But at the pharmacy, that's where again you find a problem. I have been there, I don't know how many times, because I'm just a few minutes away from Para where I stay.
Yeah,
So I
yeah.
always pass by there, and that's the area. We even have interns that are assisting the team that is working at the pharmacy. But it's a system that we must install.
Is
that
it the
will help
demand
us, yeah.
as well? Could it be the demand is huge?
The demand, remember, Bara on its own, it doesn't even have one pharmacy, by the way. Inside Bara, we have 13 pharmacies. Yes. So this one is a big one that which I'm sure we are as experienced at Konikuyu. So the Bara is big, and a lot of people are going to Bara. And we're trying to reduce those numbers by improving our healthcare at the clinics, at the district, because we have district hospitals, we have regional hospitals. But trust me, even me too, I will go to Para, by the way, or Charlotte, because you want to go to this place that you see, that you've seen that other people have been better. It's either you took your mother there and your mother was helped. So you will not want to go start at the clinic.
Yeah.
So we have that problem again,
I
that
see.
people don't want to start at
Start
the
at the
clinic or
clinic
at the
first.
district hospital or regional hospital. They want to go to Para.
Yeah.
So hence you find everybody is there. But I think again, it's just to make sure that we intensify our preventative measures so that people don't get sick.
Yeah.
That's
yeah.
another thing that we should do with these local health promotion programs that we are doing.
Yeah.
Prevention, we must prevent so that we don't go to hospitals. But
We are going to talk about that just now after
I
the break.
note what he's saying because I will tell Dr. Makana that let's speed up that process.
Okay, no, thank you very much for that call. And if you've just joined us, wherever you are listening from in the province in its entirety, it could be that you are in Tembisa, it could be that you are in the Val, it could be that you are in Kagiso, Bolepas Flay, Lusham, it could be you are in Mamelodi, Soshanguve, Godi Didi, wherever you may be listening from. This is a special conversation that we are having with the MEC of Health. Simply to get your questions. And also, the MEC is here to tell you what is happening, what has been achieved, what is still lacking behind. So feel free to call us 011-982-4495. We'll come back after this break.
Lifestyle diseases, many of which are preventable, continue to escalate at an alarming rate with a serious impact on the well-being and development of people. Gauteng, as a highly mobile and urban province, has a prevalence rate of around 40% for hypertension and 11% for diabetes, which are some of the main conditions leading to premature deaths. It's important that people take up physical activities and eat healthy to ensure that they do not acquire lifestyle diseases. Those who are already diagnosed with diseases such as hypertension and diabetes should ensure that they continue taking their treatment from their local clinics and lead healthy lifestyles to prevent early death. Take up physical activity and eat healthy to prevent lifestyle health complications. This message is brought to you by the Gauteng Department of Health. Hashtag Asibe Healthy GP.
And we are back with you. Welcome back. If you've just joined us, we are having a special discussion about the health issues in Gauteng. All of us have got health issues. So we thought today, let's have a special discussion with the MEC. She's the boss of all issues health in Gauteng. But we thought, MEC, namhlanje, spend the time with the people of Gauteng. We'll see the music later. Let's deal with these issues, clinics, hospitals, everything else. How are we going to make sure that abantu bayaluthola usizo abaludingayo? And speaking of clinics, MEC, I know I've got a friend in Orlando, ne? And he was telling me ukuthi bekayokhipha izinyo eZola Hospital, eZola Clinic, and he's been there maybe 4 times, and he's had a wonderful Ulinda. He's spoken about it so wonderfully. Do our clinics have those competencies?
We do, like the one that I opened, the Zola Clinic.
Yeah.
It's one of the best facilities. I would want you to go take a turn and see for yourself. And there are doctors that are there and the nurses that are working around there in the clinic. Yeah. It's one of the best facilities, by the way, that we have. But again, any of our clinics now that we've just recently bought or built, because we're even, I'm going to tell you about buying, by the way.
Yes.
So, but one of our clinics, we have the best clinics now. They are open, they are spacious. I call them mini hospitals because people can even deliver at the clinic. Not
Really?
go to- yes, not at the hospital.
Yeah.
So those are the environment that we are making in our hospitals because NHI is going to start at that level of the clinics. Hence, we have in the province, by the way, we have more than 400 clinics. But we have those community health centers that, those are the clinics that are more at a higher standard. The ones that I say, those are, they don't close, it's 24 hours.
Yeah.
Then we have those that close at 5 o'clock.
Yeah.
But I want us to make sure that at least in every region, there is a number of clinics that are opening for 24 hours, not less than 24 hours.
Yeah.
Although it's not easy because it will involve money. But for the start, that's something we're pushing. And we don't have enough budget, by the way, as much as I'm ambitious, but I always want to be ambitious so that
Yes.
some of these things we're able to do them. Our budget is minimal, but everybody recognizes that we do get some assistance
Yes.
at the finance team. But again, because they can see now that what we have, we use it efficiently and effectively. We don't waste money.
Yes.
So every rand and cent we account for that treasury gives us. So that's why even on the clinics, we want to better those clinics, clean pollution blocks, the garden must be proper, so that when you get in there, you don't see yourself that I am not going to come back here.
Yes.
Same as the hospitals, we're in an aggressive approach now, that at least even if a building is old, it must be kept clean. We must maintain that building because our own people go to those hospitals and clinics, and they deserve to get a better treatment in a comfortable space, because a clean place will become comfortable once you're in that place.
Yeah, yeah. Amanesi, do they still shout abantu, bachika abantu mabafik? Because there was a time when people are afraid to go to the clinics. Amanesi bazobachika and say, hey, you're not supposed to be here. Ufunani la?
Ndiyahleka because I always tell them, yekani lento yenu shout abantu.
Yeah.
Mawuclean uthukela ubuclean. Kuthi ucinga ubungibani? Waza so clean. Mawumdaka uthukela bawo uhlamba. Kutheni ungahlamba awu. Kanti abamama bafuna ntoni kum? So we're changing that, but
Yeah.
again we have youth-friendly services in the
Yeah.
clinics now for the young ones.
Yes,
For
yes.
especially because of
Yeah.
this issue of teenage pregnancy and other things. So they do promote the health, they educate them
Yeah.
about their lifestyle. You will find them, those young girls, talking to their age group nicely. So I always go to the clinic and I'll sit there and listen like them, because it's a class,
Yeah.
proper class
Yeah.
that they are being educated. You don't do this, you do this,
Yes.
until the process is, don't
Yeah.
be pregnant at this early age, because we have seen how our children have been so pregnant these days.
Yeah.
13-year-olds have killed kids.
Oh, no.
I was traumatized
Oh, no.
in
Oh, no.
December, on the 25th of December,
Yeah.
and the 1st of January, because to see a child that is 13 years holding a child, for me, it was one of the
Yeah.
issues that traumatized me.
Yeah.
But because I'm at work now, but automatically when you're a parent, you think, if it was me or my child,
Yeah.
how will I react
Yeah.
on this thing?
Yeah.
So now you leave this professional part
Yeah.
and become a parent. That's how it goes. But those are the educational programs that again we're doing in our clinics. And in our clinics, we've established the governance structures, which I've told you, clinic committees. We've inducted them, they are new. And almost every clinic now has got a fully fledged clinic committee team that is there, that is running the clinic, helping us, because they are an extension of me as the MEC, because it's a governance structure that I should make sure that it's functioning. So even in the clinics, we do launch the I Serve with a Smile campaign, because we want the staff attitude to change. By the way, I Serve with a Smile campaign was simplifying Batupili.
I see.
Yeah,
Yeah.
it's coming from there.
Yes.
But and then we make it this jolly thing.
Yeah,
I serve with a smile. So everybody is happy because they're being served with a smile.
Yeah.
And smile takes millions. Yeah.
Really?
You
I want
feel-
us, I'm sorry to interrupt you, MEC. Let's just take a call. I see that we have someone calling. Good afternoon, Sanbonani, Dumelang,
Age le kae?
Retenlekai,
Re teng le bua le Mme Magalefa.
Mema Khalifa,
Ya.
Kokai.
Mo Cape Town.
Okay, mo Cape Town. O ka ra ba tlo bolela o Kokai. O Cape Town. It's in Cape Town,
Yeah.
go Cape Town. Hi, I'm ma'am. MEC go mametse no batla reng?
Ya. Ke batla go congratulate Discovery. Service ya bona is very good. Mo Florida.
O mo Florida Discovery ne?
Ya.
O tlholo ya Gauteng.
And then kina le problem ke le ka ya ko re Discovery ile yang referela ko Helen Joseph because kina le hernia.
Sorry about
So yeah, doctor aba are ko nna ke tshwanetse gore ke lose weight. So a ke itse gore ke tshwanetse gore ke lose weight go fitlha kae, because almost every night ke suffer ka pain. So a ke itse gore tshwanetse ke etse jwang, because ntho e le hang kana di painkillers kore ha e fole, ha e nowhere. So ke etse jwang.
MEC, mamela ge mama, maybe MEC utla go fa some tips, but also you might need to go back to the hospital. Wa bona o lo ba go tlhalosetse sentle for what is going on, but MEC, I don't know if you want to add.
No, I wanted to propose that to Mama if angaya payana especially, so that but we'll communicate no Mama, so that my SCA I will tell you Dr. Pitt, the CEO in the hospital said that she must expect to Mama. Then actually I pass that's of course on the peer reports.
Okay.
I think it will be easier that we take in numbers Mama,
Yes.
so that we phone Mama back after this.
Yeah, Mama, osa dropa phone ne, ba tlong ka di number tsa gago, and then
Yeah.
MEC o tlo zama gore a go connect le CEO gore ba go expect go sepetlele ne, so that ba go tlhalosetse gantle all those things that you need to know.
Ke a leboga,
Ke a
ne?
leboga, Mama, thank you so much, and thanks for calling. O fole ne?
No, ke a leboga, mara
Okay.
discovery is the best.
Okay, thank you so much. O sa dropa phone ge gore ba nke di
No,
number
nka
tsa
se
gago.
drop.
Okay, Mama.
Eh,
Really appreciate it. And I mean, I'm sure these are some of the things that you are faced with, MEC, where some people maybe don't understand the instructions quite well, but they mean well. I mean, she's going there and she's complimenting you on the service at Discovery Clinic.
No, it's true. Almost every day you will get that, but we need. Because I have patience. By the way, I like what I'm doing now. I knew I liked finance. I like ICT when I was in the department, in those departments. But this one, I think it has bring back something to me that I didn't know. That's an element Ubuntu.
Yeah.
So I feel so good when I've helped
Yes.
abantu abadala, including abantwana when they need assistance. So I think that's why I'm enjoying my work every day. I don't mind to wake up. I work 7 days a week. I don't have a problem because I enjoy what I'm doing so much.
Certainly.
Of assisting those that I need. And I think it comes with your background because I come from a very poor background. I know my mother can't read and write. So those are the things that I get touched with.
Yeah.
If it was my mother,
Yes,
what will I do? So I need to help as much as I can. So umama siza kumsiza, and we have been helping the rest. Nabane inkinga,
Yeah.
athi bendiyile ndadiyajikiswa, and then I will tell her, go back and you will be assisted.
That's
and I will get a note that says, thank you, I was assisted.
Yeah. Let's take a break and then we'll come back to wrap up everything else we've spoken about. We are back just after this.
Immunization helps prevent diseases as well as stimulates a child's immune system to fight against infections later in life. Parents, caregivers, and legal guardians are encouraged to ensure that their children are immunized at regular ages as set out in the Road to Healthcare booklet. This is to protect them against diseases such as polio, TB, hepatitis, measles, and meningitis, amongst others. To ensure that children don't miss out on school health screenings and catch-up immunization campaigns, parents are also encouraged to sign the consent form to permit school health nurses to administer vaccines on learners and provide free hearing, oral, ear, and nutritional assessment, as well as vitamin A and deworming. This message is brought to you by the Gauteng Department of Health. Hashtag Asibe Healthy GP.
Indeed, Asibe Healthy GP, we are coming to you today, and you're thinking, what has happened to my radio? No, you're at the right station, and we are having a very interesting discussion with the MEC of Health. We thought today we're not playing music, we're changing everything because we want to know what's happening everywhere else, everything about health in Gauteng. The MEC said, I want to talk to my people today about everything else that is happening in our hospitals. We've been getting calls, and MEC of Health is here with me. We've got just a few minutes to go, MEC, so before we even leave. But MEC, wawuza namhlanje, abantu bazothi, hayi, because it's elections, that's why the MEC namhlanje is talking to us. Is it because of elections? Is it campaigning? Is this why you are talking to us, Ganje?
No, it's my work, my brother. I've
Yeah.
been doing this since I've been in that office. I've tried to improve health services for our communities. The healthcare is critical, and I think because it's this time, silly season, I will not, even after this, we'll continue doing this work, because the team is there,
Yes.
but we have to do you start somewhere when you do something.
Yeah.
So maybe they've never seen me indeed, but I would want people to follow us, even on social media pages, because we are there daily. All these 5 regions as we speak, they are buzzing, they are out in the communities.
Yeah.
So wonke umuntu nje une responsibility akayenzayo phayana. And I think the local this team that does this education, health education under health promotion programs that we have, it's doing well, especially going and visit the families, because I think we've been consistent in getting into the communities.
Yeah.
Check those that are defaulting in terms of their medication, then we found them and bring them back in the system.
Sure.
And it's one of the things that we need to do. So I'm not doing this because on the 29th of May,
Yeah.
I've been doing it, I'm not starting it, it's part of my programs, that let's be there, let's be visible, let's assist communities. It's a must that we must serve them with compassion.
When you joined this department, when you are appointed to this position, your boss, the Premier of Gauteng, Mr. Panyaza Lesufi, did he give you some strict instructions as to why this department in particular?
The first one, yes, he did. He said to me, he wants me to improve the patient experience care in the hospitals, and I must digitize the hospitals. Hence, we're starting with that process now of digitizing everything. Then he said to me, I must improve the finances of the department. There are controls that I've set up. The budget is there now. Whatever Treasury gives us, we finish it properly, and AG is happy about our performance in terms of the finance, which I really enjoy. By the way, I don't finish a sentence without talking about financial issues.
Yes.
And we're reducing accruals, we're reducing litigation. Remember, everybody has been litigating us. So now we've put up a system of mediation. Cases, some of them will say, I need 20 million in this case. We take it down to 2 million. From 20 to 2.
Really?
I'm telling
The
you.
lawsuits.
I am so excited because that's
Yeah.
something that was not happening in that department.
Yeah.
They used to pay 30 million, 35 million if they are litigated, straight
Yeah.
litigation, no
Yes.
mediation. Now there is mediation. And then he said, I must improve infrastructure. Almost every hospital is busy. We're renovating
Yeah,
the,
yeah.
the wards, we're renovating the hospitals, we're changing every area. In the kitchen, we're changing now the menu, because I've said people are not eating what they're supposed to eat. So we've changed the menu, and there's a group of students that we've taken from TVET colleges that come and help us in the kitchen, those who are doing those courses, the catering.
Yes.
So they are assisting now and train even our own that are working in
Yes.
the kitchen, mending the kitchens. Then he said again, I must tighten up governance structures. All the boards are working now. All the committees, like your clinic committees, your board, mental health review boards, they are stronger. They are working with relevant people. They meet almost every week. So we've established everything that we need to do in the department. When I go there and I'm walking tall, because I know everything that Premier said I must do. In fact, I assess myself.
Yeah.
Every Monday I monitor, where are we guys? Are we red? Are we yellow?
Yes.
Amber, what?
Yeah.
Now we're all green, but I'm continuing doing my work as if we're still red.
We're about to say goodbye. Any numbers of the department? How do people reach you if they want to communicate with you beyond this discussion?
There is a toll-free number that we're using for quality assurance, because there is a team of people that we employed in every hospital that is responsible for complaints in the hospital. We call them quality assurers. And that number is 0800-203-886. It's a toll-free number.
Yeah, please say it again.
0800-203-886. That's a toll-free number. We have an email if you want to do email. It's patient, P in caps, and then the other words, and a small caps, and then patient complaints. It's one word, dot health@gauteng.gov.za. Patients complaints, one word, dot health@gauteng.gov.za.
MEC, thank you so much for spending this time with us. I'm hoping we'll do it again very soon. And everyone who has called, everyone who's been listening, we really appreciate it. It's been wonderful talking to you, the MEC of Health in Gauteng. Nomantu Nkomo-Ralehoko. My name is Thabo Sholemashao. I loved chatting to you, and stay tuned. Someday we'll all be free. Goodbye.
Thank you so much.
Malaria is a preventable and curable disease. It is important that those traveling to endemic areas practice protective measures, which include taking chemoprophylaxis, regular use of mosquito repellents, wearing of long trousers and long sleeve shirts, being indoors between dusk and dawn, sleeping in an air-conditioned room or in a room with a fan, and sleeping in insecticide-treated nettings. People who have traveled to malaria endemic regions and present the symptoms: fever, headache, flu, generalized body aches and pain, nausea or vomiting, and loss of appetite are encouraged to visit their local clinic to get tested and treated for malaria. This message is brought to you by the Gauteng Department of Health. #AsibeHealthyGP.